Do you have back pain, leg pain, sciatic pain? Do you live in the Westchester County or Putnam County area? If you do, we can help. I'm Dr. Mike Berardis, and here at Berardis Family Chiropractic, we have a very unique device to help people with low back pain, sciatica, herniated, bulging discs, chronic back pain. This decompression unit has been a game changer for my office and my patients. We've been practicing here for 33 years. And in 33 years, I haven't seen the kind of results that I've gotten with this unit. And what I found is that when people go on this unit and they have problems with their back and they get regular chiropractic care, not only do we get them to feel pain-free in a short period of time, but we fix the root cause of their problem once and for all. The problem with spinal decompression, or spinal degeneration, I should say, is that most people don't know they have it until they reach the crisis. And when we evaluate people who have back problems and find that they're a candidate for this unit, we find that their changes and their progress exponentially increases. The great thing about this unit is that it helps to trick the muscle to not contract, and it allows for the disc to open up. So when the disc space and the nerve hole opens up, it allows the spine to recover quickly and effectively. So what we're going to offer is an opportunity for you to come in and try this unit and come in for a complimentary consultation to see if this unit is even of value for you. And so I would encourage you to give us a call at 914-962-1234 and come in, and I'll sit down with you and we will go over your condition. We'll check your spine for evaluation processes and we'll see if we need to do any x-rays, and then we'll see if this unit is right for you. But I can tell you this, in all the years I've been doing this, I haven't seen anything work as effectively or as quickly as this unit. All right, so I'm here with my friend and patient Dr. Mike here. He's going to be a chiropractor someday. And we're going to show you how the decompression unit works for low back pain. So we have this decompression unit that really helps people with herniated discs, back pain, sciatica. It's very effective, very high tech. And we're going to demonstrate how that works for you today. I'm going to just drape this across you, Mike. We're going to get your feet locked in. This is a very effective, non-invasive way to help ameliorate back pain, herniated discs, sciatica. And it's remarkable in that it's non-invasive. It doesn't require any drugs or surgery. And as he goes back on the bench, we can do in about 12 to 15 minutes what it used to take an hour or more as an effective form of treatment for low back pain, sciatica, and herniated discs. So what happens with this device is the machine gets set into a position, a horizontal position, and then the lower portion pulls, and as it pulls, it starts to stretch in traction the lower back. So as this table piece separates, it's actually effectively stretching his lower back and opening space for the nerves in the discs. What's great about this unit, though, is that it has a multitude of settings that allows for it to reset and trick the body into not feeling the response. So in other words, the muscles start to relax and it gets a very deep tractioning of the ligaments, tendons, and the cartilage, which is what the discs are made of. They're made of tough fibrocartilage. As it swings to the left or to the right, it actually opens the nerve hole on the opposite side. So as it swings Michael's legs to the left, it's actually opening. So if someone has sciatic pain down the right leg, we'll have it set to swing to the left. If he has sciatic on the other side, it'll swing to the right. Sometimes we'll have a dual swing depending on where the herniated disc is or where the pinched nerve is. But it's incredibly effective, high-tech device that really gets in there and opens space. So a lot of our folks that were scheduled to have back surgery or some invasive injection or pain management, they're able to bypass that by using a device like this. And within about 6 or 8 treatments, it can ameliorate not only the pain, but fix the reason the pain is there in the first place. Which, like I said earlier, could be a pinched nerve from the bone being out of position, or it could actually be a herniated or bulging disc. Very effective So as it does that, it's actually tricking the muscles. There's these little switches inside the muscles called Golgi tendon organs. And as this goes into intermittent traction, it'll pull and then decompress and go back again. And as it does that, the muscles actually relax very deeply. It also has vibration. So the vibration also helps the interstitial muscles to relax. How's it feel, Mike?
Feels great.
Awesome. So this is an added device that we've added to the practice. It's been wonderful for our back pain patients, and that's how it works. I found using a combination of techniques, exercises, stretches, but actually putting the work in, because when you have scar tissue, and listen, most of us have these imbalances in our spine since we're little boys and girls. This doesn't happen like the minute we feel it. Like a lot of my folks come in and they'll be like, oh, I threw my back out last week. And I'll say, well, what were you doing? Oh, I was plugging in my hair dryer, or something that you would think wouldn't cause an issue at all. The problem is that no one teaches us about spinal hygiene when we're little. We never go through the process of understanding that the spine is meant to be regularly maintained throughout your life from the beginning. So we wait for a crisis, and then we go and we get the chiropractor to say, oh, I have this issue and I need you to fix it for me. It would almost be like if you never heard of dental hygiene, never brushed or flossed your teeth, never saw a dentist. By the time you were 35, if you had any teeth left in your face, what would they look like? They'd be pretty rotten. So what I find is that people come in, their spines are pretty wrecked because they've neglected them and abused them all these years, and then they think in 2 or 3 adjustments they're going to be magically fixed. Now sometimes they do have a miraculous change that quick, but most of the times I can tell you that the scar tissue that builds up, that creates the pinched nerve, is something that's been long-standing. And so it requires repetition, and repetition is really how you get change. And when you get change to last by doing the stretching and the exercises after you've corrected the imbalance, then you have a great shot of not only fixing the root cause of the problem, but having a pain-free existence that you deserve and that you want. So most people will come in and I tried medication, I tried injections, I don't want to have surgery, and this is something that has prevented a lot of people from having to go down that road. All right, and that's a treatment on the decompression unit. Awesome.
Right.
So, when we do this pretty regularly, and we do the chiropractic adjustment regularly as well, we get a doubling effect, and the doubling effect makes our changes exponential, so that now the improvement is kind of like on a rocket ship. So we decrease the negative momentum of time and gravity that your body's undergoing every day. The stresses of life, sitting at a desk, or working in construction, or whatever it is that you do, we decrease the negative momentum, we change the trajectory, and doing this in the adjustment is like a rocket ship. And the trajectory of change is rapidly increased. So people get better faster, and they stay better longer. Does that sound good? Mm-hmm. All right, awesome. So that's what we do, and that's what chiropractic is, and that's how we've transitioned our practice to really help as many people as we can with natural approaches, keeping them off the drugs and out of the surgery table. Right? There are some cases that need that, but for those that don't, this is the way to go. So, awesome. All right, you're all set. Let me get you out of this chair. Press the eject button. You look like you're a half an inch taller.
Oh, I feel it. I feel it.